if you don't want to be on this video, so please turn off your video and please keep yourself muted because we don't need any other noises, only our presenter voice. And what else? Usually we would like to make this presentation very interactive. And Lilia, is it okay if we ask you several questions during your presentation?
Yes, okay.
Okay, so also we usually dedicate some time for Q&A sessions. So if you have questions, it's you're very welcome to this. And after this presentation, we will have some like 5, 10, 15 minutes. So, and let's get started. Lilia, please. Oh, of course, I should mention your mentor, Anastasia.
I'm
Yes.
here. Oh, sorry, you cannot see me.
Yeah. So Anastasia is infectious disease doctor who was who motivated me to do this journal club. And because this actually we usually have like 1 to 2 journal club per month, and today we have 3rd journal club in May, and hope you enjoyed because the theme is very nice and very important. It's about, so because our journal club is actually, I try not to restrict it to any specific theme, and I of course would like to learn something about brain and about psychiatric disorders, about substance use disorder, but we usually would like to see some interdisciplinary questions. So here it's infectious disease and psychiatry, and and I think this is super important theme because psychiatry is very dynamic field, and it's changed over time. So okay, let's get started. And Lilia, can you just mention like who are you and why you choose this theme, and like 1 minute about this.
As you know, my name is Lilia. I'm a 5-year student of our university. I don't choose my future specialty today, but I'm interested in a different subject, and from all subjects, psychiatry and infectious diseases are the most interesting for me. And as for took part in Journal Club, it's a new experience for me. And when I first listened about it from Anastasia, it was very interesting, and I think that it will be useful for me in future.
Thank you. And since previous Journal Club, I start one tradition when we, so what is new today? So we have 2 people who prepare for this presentation, and it's kind of like opponente. I don't know how to speak English. So those who prepare some advantages and disadvantages of the paper. Mikhail, if you're here with us, so I would like to say thank you for this idea to you. And so we have today Pavel and Ekaterina. One of them is good cop, the other is bad cop, and they give us some resume of their work on this paper after your presentation. And before we start, I just want you everyone for probably for 1 minute, turn your camera on if it's possible, and just say who you are, like your name, where are you from, your university, and maybe a couple words about like why you're interested in infectious disease or psychiatry, like why you're here, if it's relevant. If not, just pass the turn to next person. Okay, I would like to hear Anastasia. I mentioned you, but I not really present you. So Anastasia.
Okay, thank you. Sorry, but I still cannot turn on my cam. So I'm, as always, from the black side. I'm also assistant professor from infectious diseases department of our university. Why I'm here? Just because I like everything that is related to critical analysis of scientific works, and I think that it's really useful to practice this kind of activity, and if we do it together, it's great for all of us, and it always better when we have someone else thinks about some research works, etc., etc. Something like it. Thank you. And I want to say a few words about, I still hope that maybe we will see today our expert in psychiatric, Anna, but she's not here yet. And Marina, if you can, and I know that you can, you can be our expert too, I guess.
Yeah, and I actually would like to mention that today we have Mikhail Sorokin, who is a psychiatrist at and working in Bechterev University, and I think he would also join us in discussion.
Oh, great!
Psychiatry.
Thank you.
So next, Mikhail, probably. Can you introduce yourself and say a couple of words? Mikhail, I see you that you are muted, but we don't really can hear you. Is anyone can hear?
No.
Okay. While Mikhail working on his voice connection, Pavel, let's continue with you.
Yeah, I'm a 6-year medical student right now, but I'm not gonna specialize in psychiatry, but I'm just generally interested in how clinical research is done, about methodology of good quality clinical research, and that's why I'm here, for improving my knowledge about clinical research and evidence-based medicine.
Thank
That's
you.
all. Yeah.
Okay. Marina, you're next.
Hello, my name is Marina Yurkina. I'm a 5-year medical student and at first Pavlov's University. I'm interested in journal club and for me it is also an interesting experience. It also helps me improve my English and improve my critical assessment. So.
Okay, good. Natalia. Okay, while Natalia is preparing, Ekaterina. Oh, Natalia.
Hi.
Okay.
Hi guys, I'm Natalia. I'm from psychiatry and neurology at
Natalia, we don't hear you very well, so please be sure that your mic is near to your lips.
Looks like we have message from Mikhail, and his microphone doesn't work.
Okay. 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 I just would like to say that Mikhail and Natalia both working in Bechterev National Center of Neurology and Psychiatry. So I'm not sure how. Probably I make some errors in this name of center. We changed several times, but anyway, Natalia is neurologist and Mikhail is a psychiatrist. So, and I think it's very important that you have this expert here, and they're doctors already with experience. Okay, and Ekaterina. Thank you, Mikhail.
Hi all. I'm glad to see all people here. I'm Ekaterina. I'm 4-year student here in our university, and I'm also very interested in journal club because I'm interested in evidence-based medicine and something like that. And today I'm going to be a bad cop, as Marina said. I don't know, would it be effective or no? Let us try. Thank you.
Okay, Lilia, it's time for sharing your screen, and we are ready.
Нужно, чтобы вы включили демонстрацию экрана.
А у тебя нет, да, прав?
Не-а.
Чтобы это сделать. Так, сейчас, секунду. Так, я извиняюсь за это. А как же мне это сделать? Тогда кидай свою презентацию мне, а я ее открою. Можно, мне кажется, даже вот здесь скинуть ее.
А как тут скинуть?
Окей, тогда по почте.
Марин, там есть где демонстрация экрана, такая справа на этой кнопочке стрелочка обычно, и если ее нажмешь, там можно разрешить другим транслировать.
Вот, понимаешь, вот я помню, что она действительно была, но я почему-то не могу ее найти.
У меня она обычно вот прямо где клавиша демонстрации экрана, на ней.
Вот понимаешь, да, я тоже на нее жму.
У кнопки демонстрации всплывающая стрелка.
Стрелка.
Пишет Михаил.
Да, спасибо большое. Ну вот у меня вот есть этот шар-скрин, стрелочка. И все, я на нее нажимаю.
Нет, это не она.
Может быть, Advanced. И почему-то ничего не хочет. Я предлагаю просто Лилия, наверное, прислать, на почту, так будет быстрее. Какой-то слава. Да. Я очень извиняюсь, что мы так вот... Что-то, видимо, я в зуме какие-то там настройки, что-то там не сделала, чтобы он мне эту стрелочку показывал. Пардон.
Может быть, там, кстати, в базовых настройках, может.
Да, там просто он иногда... Ой, зачем я это нажала? Я зачем-то нажала update now, чего-то там. Ладно, я надеюсь, что все сейчас будет хорошо. Так, я шарю нашу презентацию прекрасную. И вот так вот я делаю красиво. Так, ну что, Лиль, тогда, я думаю, мы как-то с тобой сообразим, когда мне переключать.
Okay. I will say next slide.
Okay.
No, the first.
Все хорошо видят, просто чтобы убедиться.
Да, видно. Ага, только первый слайд.
Не видно второй слайд?
Не, все видно, в смысле.
Видно, что я переключаю.
Да.
Окей, Лиля, сори. Давай.
Okay. The first slide. Okay. Again, hello everybody. I'd like to introduce you the article Increased Systemic Microbial Translocation is Associated with Depression During Early Pregnancy. This article was published in Journal of Psychiatric Research in 2018. As you see, the impact factor of the journal is 3 and 9. The next. As for the prevalence, peripartum depression is a disorder that occurs in 8-15 of childbearing women. The first trimester is the most vulnerable since the most important changes in the hormonal system and mental condition take place. Also, authors of the article note that the first trimester is the most vulnerable part, but after they suppose that the alteration of sex hormones in pregnant women with depression may result in a disruption of mucosal barriers and subsequent elevated microbial translocation plus systemic inflammation. And based on this, formulate the study hypothesis is microbial translocation is associated with depression during pregnancy. The next. Here we should notice that this kind of the hypothesis is very controversial, since association does not imply causality. Even if we confirm that kind of the hypothesis, it will work the same way, for example, for another pathogenic chain, like increased translocation leads to depression. So it will work as well for microbial translocation is associated with depression during pregnancy. So I'd like to say that we say only about association with microbial translocation and depression, but we don't say about causality. So what was first, microbial translocation or depression? The next.
Лиля, попробуй сейчас сама. У тебя должно получиться.
Сейчас попробую. Так. Наверное, надо, чтобы вы закрыли. У меня вообще теперь не светится демонстрация экрана, потому что светится вот то, что вы включили. Так. О, ага. Нет, все равно написано, организатор отключил демонстрацию.
Так, зачем я это сделала? Окей.
Yes, about this slide, the longitudinal study was conducted with 3 control time points. The first one was at 8-12 weeks gestation, the second was at 24-28 weeks gestation, and the last one was at 6-8 weeks postpartum. The next. As for the participants of the study, the total number that was included in the analysis was 28. But according to the article materials, 28 participants were included in the analysis, but there is no data about actual sample size. And there are some reasons to doubt that it was similar, because study groups were formed only after whole sample collection, and we will see this in next slide. We have inclusion and non-exclusion criteria. Inclusion criteria was pregnant woman receiving routine obstetrical care, age more than 18, gestation less than 12 weeks at the first visit, and non-inclusion criteria was age younger than 80, mix of gestation more than 12 at the first visit, and not signed informed consent. The next one. As for the methods, in all 3 study control time points, next parameters were measured. The first one was depression, of course. According to depression scale, APDS, I will say about it later. Also, we see biomarkers of microbial translocation in blood. It was LPase, lipopolysaccharide, endotoxin, and biomarkers of systemic inflammation in blood, TNF-α, interleukin 6, interleukin beta, and MCR. The next one. Here I'd like to say some words about APDS scale, Edinburgh Postnatal Depression Scale. The APDS is a 10-item questionnaire. Women are asked to answer each question in terms of the past 7 days. As we can see, there are different questions. There are questions about laughing, for example, enjoyment, panic, sad or miserable mood, sleeping at last 7 days. The next one. And the most important question was the last one. It's the question where we want to know whether the thought of harming yourself has occurred to women. So you can look again at all these questions and it was important to know about answers of these questions in terms of 7 days. The next one. And after this, it will be good to say about groups, that all participants were divided into groups using this scale. Participants who scored 10 or greater at the APDS, at least at one study visit, were considered depressed. Number of such participants was 14, and number of healthy controls was also 13. And participants who scored less than 9 were considered as healthy controls. Since not all patients at the first visit scored more than 10 points, it means that groups were formed only after all 3 visits. We can see at this table that in depressed patients, not all of them at their first visit have more than 10 points on the APDS scale. The next one. Here we can look at some clinical characteristics of groups. As to say about all of them, we see that their mean age of a woman was 30, with no significant difference between groups. There were also no significant difference in BMI, maternal BMI at visit 1, and obstetrician anamnesis data. Here we can see gravidity, parity, total gestation weeks, some information about previous psychiatric disorders, alcohol drinking, systemic antimicrobic treatment, fetal sex, delivery type. The next one.
Can you explain what do you see in this table? Like what does tell us?
It tells us the median age, for example, of 2 groups. Also,
I mean, compare like here you see a comparison between 2 groups and their demographics and clinical characteristics. And how, like when you compare it, what do you see?
We can see that there are no significant differences between 2 groups.
Yeah, exactly. And can you explain a little bit what does gravity mean and parity mean? Because I think it's not really.
Gravidity is how much pregnancies women have at, for today. And parity means how much of the pregnancies ended with total week gestation more than 28 weeks.
Yeah, and what about BMI? Is it like normal or not normal? Like,
it is normal in 2 groups, and it will be interesting associated with microbial translocation, for example.
Yeah.
The reason why the authors use such characteristic.
What do you mean that it's BMI is associated with microbiome or microbial translocation?
I guess it's my question. I can say yes, that we know that it is common correlation, and it definitely can be associated. That's why we usually try samples for this parameter when we say about microbial translocation.
So, and it means that it's like linear relationship between these 2 parameters. I mean, like
it's not a linear relationship. No. It's like confounding factors.
Okay. Okay. Does anyone have any other questions about the table? Okay. Please go on.
Okay. The next slide.
Okay.
Here is the continuum of clinical characteristics. Here we can see, for example, that ethnicity was also determined, and predominantly women in both groups were Caucasian. We should pay attention on some characteristics of studied sample as education level and family income. Depressed patients have tendency towards family income and lower education than healthy groups, healthy controls. Both factors are known to lead to higher depression frequency and also may predispose to gastrointestinal problems. So here we see that there were differences between two groups, especially in education and family income. And such characteristics are very important according to depression, about which we say in this article. Also, we can pay attention to smoking, for example, that depressed patients smoke more than healthy controls.
Yeah, and it's interesting how they define former smokers. Like, it's not smoking right now, or they not smoking during like last week or last year. Is there any details in this? I don't.
No, we don't have information about it.
Because probably they don't smoke like during pregnancy, and this is not really former smokers. I mean, it's current smokers.
It's unclear.
Yeah, usually like former smokers is those who don't smoke like for at least 1 year. Okay.
Okay, the next one. Here we can see a table about statistical analysis. As independent variable was used depression, presence or absence. As dependent variables, we use primary outcome and secondary outcomes. As primary outcome was LPS levels, and as secondary outcomes was pro-inflammatory cytokines levels. Only age, race, and BMI was included in the analysis as potential confounders. And the next one, oh no, previous, yes. And multivariable linear regression model was constructed to analyze the differences in plasma biomarkers levels between groups. That is all about statistical analysis. And now I'd like to say about the results. Yes, at first we will stop at plasma levels of LPS. Authors found that in adjusted model, the plasma LPS level was significantly higher at the first visit in depression group in comparison with the controls, but there were no significant differences at the next visits between two groups of study. Also, LPS level at the visits 2 and 3 in depression group was significantly lower than at the baseline. So the the most important was that we see that at visit 1, women with depression has had a higher level of LPS than healthy controls. The next one. Then we will look after pro-inflammatory cytokines. The distribution was similar for the plasma TNF-α and MCP level. Significantly higher in depressed subjects at visit 1 compared to healthy controls, and no differences for following visits. So it's the same situation as LPS plasma levels. The next one.
May I ask you one question? Like, why do you think they present the data as a median, not as mean as usually?
Can you repeat the question?
Yes, sure. Why do you think that they present their main result as a median And here, as you see these like dots, it's actually the observation from each person, right? So you see like you're supposed to see like 14 dots, and they present like to see this when you see. And I actually appreciate it because here this is a good example how to visualize your data. And I just want you and other who join us thinking about why they present us as median, not as mean. Does anyone have the answer? Because it's kind of very like simple statistical point, and I think this is like very.
I think that I can help. It's mean
I know that you can.
Yeah. If someone needs help, okay.
Lilia, do you have idea?
Maybe it was the most the height frequency. This median level is the level which was which we see more often than other levels of.
Yeah, and why it's important to present this, not mean.
As to be honest, I don't understand the difference between mean and median, and I have it's difficult to answer.
I'm sure that someone can help you. Ekaterina, any idea?
Yes, I suppose that they choose median, not mean, because their samples were not very homogenic. They were heterogenic. As you see here in these pictures, the dots, some dots are very higher than other, and if they choose mean, it wouldn't be representative.
Yeah, I like almost right. So I would like to say like how to usually, when you see this kind of data and you see a lot of outliers, so here you see that not everyone like near to this median level, right? So you see actually like this distribution is pretty wide, and you see like there are some outliers. For example, if you see this like visit 1 on A, you see here like this observation is pretty like we can say that probably it's outlier. And if you put it as a mean, so mean is when you have a sum of all observation that you have and divided by number of observation. So you couldn't see it's not give you the proper information about actually what is the most frequent observation, what is the more frequent number of observations, as I can say it. So as you say, yeah, like median is that you it's like MODA is the most frequent result that you can see, but median is give you information about what divided your population, like 50% of the population below the median, and the other 50 is how to say above the median. Just like divided like 50 by 50. And presented it give you a more higher quality of information about what is the distribution of your outcome of interest. And so that's why median and interquartile range is usually investigators choose it because it gives you more accurate information about the outcome, and it's not really because it's not influenced by outliers. Does it make sense? Does it make sense?
Yes.
Okay. So I just want to notice it because usually like, and we actually have it before that someone asked like why we don't present mean but we need to present median. And I won't just say you that if you have very small population group, if you have very small sample size, you should also see on distribution of your results. And if it's like kind of very wide, you have a lot of outliers, you should present it as median and IQR. And here I think this is one of the lessons from this paper. Okay, let's move to next slide, right?
Yes.
Okay, next slide.
Here we can see interleukin 6 and interleukin 1 beta levels, and at the same time plasma levels of interleukin 6 and interleukin 1 beta at visit 1 were similar among depressed and healthy women, but plasma LPS level, plasma interleukin 6 level was higher in depressed subjects at visit 2, but not at all other visits compared to healthy controls. From this slide, the most interesting is that interleukin 6 was increased only at visit 2, not in other visits. The next one. And if we summarize the results, they will look like on this slide. That level of LPS, TNF-α, MCP were increased at first visit, 8-12 weeks gestation, and level of interleukin 6 was increased at the visit 2. And the next one. And based on these results, authors make a conclusion that first, increased systemic microbial translocation is associated with depression during early pregnancy. And also support that early diagnosis and treatment interventions of depressed mothers may be imperative according to their results. The next one. And only a few limitations disclosed by scientists as a small sample size and necessity to include some other confounding factors. As several confounding variables, we can see fetal sex, type 2 diabetes may need to be controlled. And
I would like to say that probably these limitations is actually highly related, because if you put more confounders, you need more sample size.
Yes.
So it's kind of like tricky. So that's why they probably choose only 3. So it's kind of this limitation is have a root from the sample size that they have. That's good point. Right.
Okay, the next one. And I'd like to ask some questions for discuss. At first, the questions will be about hypothesis, about the study design, about the results and conclusion. The first one, of course, is what the base hypothesis proved. Yes, of course, the hypothesis was proved, but conclusions are not consistent with the hypothesis and do not follow the results. Despite the significantly high level of LPS was found in the group of depressed women at the first control time point. The exact depression took place predominantly at the second visit and postpartum, and not early pregnancy. So we achieve a high level of LPS at first visit, but we don't achieve points more than 10 by APDS scale. Most of women don't have depression on their first visit, so don't have depression at early pregnancy. And since only longitudinal study conclusion about treatment strategy cannot be done, at least a prospective study needed to confirm causality.
We have one question. What is the difference between longitudinal and prospective?
Longitudinal study, we have control points, so we look at the study in process.
Okay, and prospective?
Because
it looks like you say that longitudinal study which we see in this paper is not really good, like for making any conclusions, but we need prospective study. to confirm causality.
Prospective study we need if we want to say about causality. So what was first, depression or microbial translocation?
Yeah.
But as to see to our at our hypothesis, we want to say only about association with microbial translocation and depression. And longitudinal study is okay for it, but it will be not okay for confirming causality.
Is anyone agree with this point or disagree? Okay, probably it will be for our opponent, for bad cop question. So you can.
May I ask another question?
Okay.
Yes, yes.
About the Edinburgh postnatal depression scale.
Mhm.
I didn't understand. I googled it, and as I see, this scale uses to diagnose postnatal depression, and the results interpreted as probability the postnatal depression would be after pregnancy, postpartum.
Mhm.
Why did they choose this scale for women? Why did they choose this scale to diagnose depression? I don't understand.
I also have such question, but we have a discussion with psychiatric, and he said that this scale is also good for pregnancy, not only for postpartum. So it's a good instrument to understand whether we have depression in pregnancy or not.
Can you return to the slides when you actually, I like the slides when you put exactly the questions which was asked this woman. As I remember, while you looking for this, oh, actually, this is question for me because I can't follow the presentation. Sorry. While I'm looking for this, looks like they not really ask some questions, particularly ask about pregnancy or post-pregnancy period. So it looks like this is just questions about how you're feeling, and I don't really see that this questionnaire has some questions specifically designed for pregnancy. So I think this is no problem for using it in pregnancy. The question, no, again, this is the question about validity, and as any other questionnaire which we used in our research like aims, we need to use validated and questionnaire which was before tested and retested in the population which we are looking for. And here we are looking for population like during their pregnancy and after the pregnancy. And probably this test was designed and they was validated among women after pregnancy. And probably in this paper they just use it like probably it wasn't like large studies on large sample pregnant not pregnant like woman who gave a birth. So this is can be problematic, and it's question about validity. But I think as a question,
I have an information about it. We've discussed it with a psychiatric who is a specialist in the field of this kind of studies, and she said that it was validated and that is really in pregnancy, yeah, and that it is a specific instrument good for pregnant women and for postpartum, since it excluded some factors as somatic, which can be related both to pregnancy and to depression. So it's more specialized than our questionnaires related to depression, as I understand, as I understood that.
Yeah, and actually,
experts said.
Yeah, and actually, you are doing a great job, and you put it like little how to say this, like apostrophe, like developed for, but can be used, like developed as personal, but can be used. So there are no problematic about this. But
I think I can add some points for this questionnaire. I think that this is such kind of screening instrument for depression, and we can't say that this is clinical depression in these persons, and it's like a screening for depressive symptoms, and we can't give them a diagnosis of depression.
Yeah,
I think so.
Yeah, thank you. This is a great point, and it's actually the other questions to the researchers who write this article, and about how they, from my point of view, they was not really delicate with the terms, and that they use like depression or depressed person. I think like usually like what we do in our study, like we say like person with depressive symptoms, because it's make you put in like more less vulnerable position, and like it's like more because it's again like this is question when you're talking about like depression, it's actually it's diagnosis, but you couldn't diagnose like psychiatric disease based on like 10 questions, and it's obvious. And of course like you can use it in research purpose, but it's also important how you demonstrate this in paper, and I think here authors can be more accurate with terms. Do you agree, Mikhail? Like what do you use?
Exactly. Moreover, they could use a specific diagnostic questionnaire for depressive disorder if they want to get some connection between diagnosis of depression and translocation. But this we can see that they receive connection between depressive symptoms or depressive personality, but not the depressive disorder and this translocation.
Yeah, I see that Anna joined us. Anna, can you hear us and see our screen?
Вот Анна пишет, что не получается войти.
Нет, сейчас получится, вот сейчас должна быть, я ее вижу. Может быть, такая же проблема, как у других была. Ребята, а вот как вы справились с тем, чтобы зайти? Вот у кого-то тоже была проблема?
Нормально справились.
Нормально справились.
А что сказать? Написала.
Сейчас. Паша или вот Валентина, как у вас? Вот Валентин не вижу. Паша, что ты сделал, чтобы зайти?
Просто подождал, у меня в приложении потом открылся. Да,
просто ну, вот видишь, просто подождать. Ну, я ее вообще... Анна, сейчас анмьючу. Анна, нужно нажать на какую-то кнопочку, чтобы микрофон включился, unmute.
Войти в аудиоконференцию там еще бывает нужно.
Да. Вот я вижу, что она присоединилась, но она
вот тоже
замьючена, и я не могу ее, к сожалению, анмьючить.
Ну да.
Не получается. Анна?
Да, слышно меня?
Да, Ора.
Привет.
Welcome to our Journal Club.
Неужели?
Anna, can you introduce yourself before we start asking your questions about the paper? Like, where are you from, who you are, and I mean, professional level. Like, where are you working, and who are your, like, your education?
It's a surprise that this conference is in English, really.
Oh, okay.
Maybe I missed it.
Sorry. Аня, расскажи, пожалуйста, о себе, про твою работу и где ты работаешь сейчас, и кто ты по специальности.
Ну, я могу попробовать это сделать на английском, но...
Как тебе удобно?
Дико буду лучше по-русски, наверное, все-таки так будет.
Выбирай сама. Тебе удобно, мы ко всему готовы.
Ну, прекрасно. Ну, я работаю психиатром в Кащенко. Основное мое место работы. Закончила аспирантуру в педиатрической академии. И тема моей работы была послеродовая депрессия. Вот. В данный момент еще работаю в СМ-клиник, если кому-то это вот интересно.
Мы сейчас как раз обсуждаем про вот как раз шкалу, которую использовали в статье. Не знаю, как правильно она говорится, эдинбургская, да, шкала депрессии, постнатальная, как правильно. Вообще, насколько...
Да, все правильно.
Ага, да. И мы пришли к выводу, что эту шкалу можно использовать как беременным, так и роженицам после того, как они произвели, так сказать, рождение ребенка, произошли роды.
Ну да, так и есть, вполне ее используют и там, и там.
И в России популярна, да, эта шкала?
Ну, это самая популярная шкала в данной ситуации. Ну, как я уже писала, ее используют, потому что там исключаются критерии соматические, которые используются в других шкалах. Поэтому она очень удобна и исключает какие-то ложно-положительные, ложно-отрицательные результаты.
Угу. И еще у нас был такой небольшой консерн по поводу того, что это все-таки шкалу можно использовать для того, чтобы находить депрессивные симптомы, но для того, чтобы поставить диагноз, да, депрессия, такая шкала не очень подходит, то есть она больше такая для скрининга каких-то вот депрессивных именно симптомов.
Ну да, безусловно, так и есть. Конечно, там очень мало вопросов, и она чисто используется, в том числе может использоваться обычными докторами, там, может быть, даже средним медперсоналом, чтобы просто, дать сигнал доктору, определить, надо там копать дальше или не надо.
Окей, спасибо. Так, тогда двигаемся дальше.
Были еще вопросы, да.
Да, я вот пытаюсь сейчас, мне периодически слушается. Ага, пошло. Вот.
The next one.
Okay, may I still, okay, let's return next. Let's return to my question after.
Here we can see the question about materials and methods in our study. At first, were study groups formed consistent with the aim of the study. We should think about a third group to compare data on microbial translocation, not pregnant women, or at least we need to take into account literature data about psychological LPS levels, because the authors of the article don't give information about normal level of LPS.
Yeah. So, and you recommend to like add third group, like control group?
Yes, maybe it will be good.
But they have healthy controls. What do you propose?
They was not healthy, they was pregnant.
But pregnancy is not disease.
Yeah, I know.
Healthy women who are not pregnant.
Yes.
Okay, it's clear now. Okay.
And also about this question, unclear sampling, as I say earlier, total number of participants, because I think that it was not only 28, there were bigger sample, and from this sample we choose only 14 pregnant women without depression and pregnant women with depression. Was the sample homogeneous? Any other potential confounding factors? At least different educational and income levels were not included as confounding factors. Because as we say in the slide about statistical analysis, they look at confounding factors only at age, race, and BMI. But we know that family income and education are also factors which can influence depression in pregnant or not in pregnant women. And the third question was instrument to assess depression adequate and enough. We already asked answer to this question. We hope that it was enough to say about symptoms of depression in pregnant women, but not to say that they have a clinical diagnosis, depression. Also was a methodology to assess microbial translocation and systemic inflammation adequate and enough. We use only the authors of research use only one marker of bacterial translocation assessed with no direct data about immune consequences of such translocations. For example, other biomarkers which commonly accessed in such types of studies. And no, we don't have any explanation about the spectrum of exact pro-inflammatory cytokines.
What do you think it will be adequate number of biomarkers, and which one you will include in this analysis, if you can? Like, for example, you have money, you have reagents for laboratory testing. Like, what do you think is missing and why it's important?
I think we can add, for example, interferon gamma to this study. Maybe other interleukins, interleukin 8, for example. But I think that interferon we should add, but maybe the authors don't have such ability to use it.
And why they choose only, like, why they actually choose these biomarkers? Like, and I was surprised, like, LPS, like, why LPS? It's kind of
it's the primary marker of translocation. It's
like,
good and it's okay, but it's a bit weird, like many other points in this article, that they actually try to talk about microbial translocation and use only LPS level and a lot of wide spectrum of cytokines, but they even said at first, but it was shown earlier that cytokine levels are higher in these women. And if we want to assess microbial translocation more deeper, we should also see such markers as soluble CD14, as antibodies to antitoxin, and some also which can also show us the immune response to this translocation. It's like, does this antitoxin have the biological effect in the organism when it's translocated? Since if it's not, it doesn't matter if it's higher or not. So it's a very narrow list of translocation markers, only one, only one marker. We cannot do any conclusions on this base to be true.
Yeah. Yeah, I mean, like, for me, it looks like they're trying to explain why they use, like, but yeah, I think it's very, very, like, little data about, like, they have only one previous study and they made by themselves, I think.
No, and the toxin is a common marker of translocation and it's widely used, yes, but it's also used in combination with others.
Yeah. Okay, and like for me, like, to be honest, like, first impression was like they probably choose the primary outcome, the one which they have like interesting results, not just
no, it's really a translocation marker, and ours are definitely markers of systemic inflammation, but they try to talk about translocation this article. So no idea why it's so.
Yeah, and why they don't look on the, like, relation between these markers? I mean, they all kind of indicators of immune, like, inflammation, right? So, and probably it will be some correlation between them.
They say that microbial translocation, the representative marker of microbial translocation is LPS, and LPS stimulates immune cell to toll-like receptor 4 pathway, and it will lead to systemic inflammation. So they look at pro-inflammatory cytokines. That is the correlation between microbial translocation and cytokines, which they also try to.
Yeah, I kind of understand like why, like the theoretical basis on this, but the point that why they don't give us this information, like why they, it's understandable as these biomarkers are somehow they're related, but I mean, this is, why don't show it to us, like these results, like how they correlate between each other. I appreciate, like it looks like it's a very like short communication article, and it's just like 2 pages, and there are like probably they was limited by number of words, but for me it's like it's not really understandable why they choose exactly like this set of biomarkers, like why they choose it as a set, like why like this like LPS and the other, and when you demonstrate like a lot of biomarkers, you're probably interested in how they related between each other, and I think it will be like it make this paper like more stronger when you also give the information about like do they actually correlated or not, and in which way, like so the thought.
Oh, I would like also to add about some information about lipopolysaccharide, because it's a marker of gram-negative bacteria only, but there are also gram-positive bacteria in the gut, so we didn't count them in this research. In my opinion, maybe a peptidoglycan will be the better choice to assess both gram-positive and gram-negative bacteria.
Which you, sorry, can you repeat please, what do you offer?
Peptidoglycan.
Oh.
It's also a biomarker of microbial translocation, and it's present in both types of bacteria. Maybe it will be better.
It's also can be 16 as RNA, but both of these markers are more difficult to test. It's more expensive. Yeah, I guess that's why. But about endotoxin and that it is only from gram-negative bacteria. Yes, it's so, but we know that the predominant in the gut are gram-negative bacteria. So this methodology is possible. It's not a big mistake to use endotoxin to assess translocation.
Yeah, and
I have some points to say. I think that this is quite tricky article because we see some very interesting points. We see depression, very interesting. We see translocation, very interesting. We see pregnancy, very interesting. And then we try to understand why these 3 words are connected in one article, and try to say to ourselves that maybe depression and pregnancy was associated with this translocation, but we don't really can't say anything about this connection, because we can't say that this is depression or depressive symptoms. We can't say whether this is depression only in pregnancy or depression in other people have the same mechanisms with translocation. We don't understand why they choose translocation to connect with depressive symptoms. So I think that they pointed their hypothesis, but they don't tell us about the aim of the study. I think hypothesis is very interesting, but what is the aim?
You mean
why they want to assess this connection? And I think that this is quite exploratory research, because such question like connection, it's not interesting for me, because we can see a lot of connections between cheese market and suicides in USA, between air crashes and I don't know, windy weather in Norfolk. We have a lot of connections and correlations, but these correlations and connections have sense only if we have some hypothesis of mechanism of this connection. But in this article, we don't have, for me, such mechanism of connection, such etiology or pathogenesis of depression symptoms, translocation, and especially with pregnancy. The main question for me is the same mechanism presented in men, in elderly people, or only in pregnancy. I don't know.
I think I can comment it also, because authors write in discussion that there were previous studies where authors showed that in pregnant women there's an increase in estradiol and human chorionic gonadotropin levels, and this increasement can lead to the increase of mucosal permeability. And that's why I think authors choose this sample, I mean, pregnant women.
Yeah, I can also comment on this. I think this is like one of the, not like, as I said, like psychiatry is the field is like kind of very dynamically changing. Like before we think that this is like more like moral disease, and right now we know this like have some physiological aspect of this, and we know that neuroimmunology and neuropsychiatry is one of the dramatically important fields, which kind of new, and there are a lot of questions about like how our central neural system and immune system or hormone system working, and we understand that everything is connected in our body, and we not really know what is the role of immune or hormonal system in psychiatric disease or psychological states. And I think this is one of the interesting questions for us as a like modern psychiatrists and modern researchers in psychiatry field. And I think there are like couple papers which review the connection between immune and neural system, and what is the role of hypothalamo pituitary adrenal axis on this. And we know that cortisol in depression, it's like we have the dexamethasone test, right? And we know that cortisol is usually it's very high in depressive patients. And so that's why we know that like hormonal system, it's like we have neurohormonal regulation, right? And of course, like we right now on the initial stage of understanding how it works, so probably this paper is just like trying to find some biomarkers of depression and how we can use it as a probably Mikhail asked about like what is the aim, like yeah, like how we can use it like in practice. like what is this it's like theoretical hypothesis is good, but it's a lot of crazy hypotheses, like what is the like implementation in real life. And I see this paper as like the searching for potential biomarkers to screen and diagnose tendency for depression in pregnancy women, because this is like very it's important problem, and we know that it's kind of widely how to say, like, distributed in our world among pregnancy women, especially now during this time. This is question, like, it's still I think there are a lot of theoretical unknown factors, and they just trying to look on this like potential mechanism of immune system in developing depression symptoms. And I think this is the idea comes from understanding how immune system influence on hormone system, or other way, like how hormone system change our immune system. So that's why they look on pregnancy women which have like very unique hormone status, and that's why they they choose this like population of pregnancy women. And I think this is a great idea to also include not pregnant women, and to do this like kind of prospective study, and to see to look on this on the woman like before pregnancy and during pregnancy and after pregnancy, to distinguish where is depression related to pregnancy, where is depression related to like it's kind of state, it's kind of characteristic of patient, like, and this was like before pregnancy, and to see what is the changes like during the time, so to see this causality effect. So yeah, this paper have like limitations. They look only one very like restricted sample, but I still think this is like have some potential for bigger study.
Yes, so I agree with you that we can widen the research and add to this research another control time points, for example, before pregnancy, or maybe after 1 year of pregnancy, and also widen it with association with sex hormones in woman's body.
Yeah, exactly. Because like pregnancy is kind of like stress like state for women, so, and it's probably, it will be interesting to see like on the stress hormone as well, and how stress hormone related to immune biomarkers. So this is like still, I think the question is amazing, and we need like more study like this, like on more like bigger sample size. Okay, maybe we give the probably this is time for our cops who already make some points and some questions. Maybe you have something which we not cover yet during our discussion, which you want to focus our attention on. So let's start with bad cop. So let's do.
Can I ask one question before we start with? I would like to ask a question about previous slide. Can you turn on it? And
this one?
Yeah. This is a text that says that despite significantly a high level of LPS in the group of depressed women at the first control time point, the exact depression took place predominantly at the second visit, and I didn't understand how do we know about that, because I thought that depression was measured only once at the screening, and after that we defined 14 patients with depression and 14 patients without it. And I didn't understand, did they measure with EPDS scale on each visit or no?
Yeah, looks like this. I don't really find this. I find it in presentation of Lilia. Lilia, where do you take this table? Because
the supplementary data of the article.
It wasn't supplemental. So as you see, yes, they did it like 3 times. And actually, I have one other question about this. So they said that they include a population in their sample size if and divided it by 2 groups based on this APDS score, and cutoff was 10. And looks like on the first visit, so it was 10 in any visit. So I mean, like it looks like it can be like on visit 1 or 2 or 3. Right? So the inclusion criteria was actually, I mean, it wasn't inclusion criteria, but it was like the criteria how they divided the groups, right? And I just want you to probably discuss about, like, do you think this approach is reliable? Like they choose not based, they divided by 2 groups just because it was like 40 and 40 because I see that on the first visit it was a lot of patients who not actually met the criteria of depression symptoms. So that's why I think they probably I don't know, kind of manipulated.
Manipulated, yeah.
Yes, I already said about it that we don't see points more than 10 at visit 1 in depressed rooms, but we can see at visit 2 or visit 3, so they put people in a group of depressed patients only because they have APDS scores more than 10, at least at 1 visit.
Yeah. And I mean, it's again, like it's questionable because when we see actually a difference like in biomarkers during the visits, but our like main independent factors, it can be on any visit. So for me, it's kind of the question, like how is it reliable method? Because independent factor, especially when you like trying to solve the problems about the like to find the predictors of like in this case it's microbial translocation. So your independent factor should be on the like baseline, on like before your dependent factors was like the data about your dependent factors was collected. So here dependent is biomarker, independent is, dependent is depressive symptoms, and independent was biomarkers. And your dependent should be should be measured on the first visit, like before we see the results. So it's longitudinal study. So we collect data on like several visits. But should we actually divided the groups on the baseline? And it's actually kind of tricky when they put like table 1, it's like baseline data, right? So it's about like age and other. So and they say, okay, like these groups was not different, but something was different for them probably on baseline because some of them was on already met this criteria of depression, some not. Like at least like 1, 2, 3, 4, 5, 7. Like it's half of the population in depressed person wasn't met criteria of depression on first visit. And then on the table 1, they present data like on baseline. So you see the point? Like this is kind of strange for me.
Yeah.
Yeah, and I wanted to say about it.
So sorry, Ekaterina, I stole your point probably.
It was my bad point. I wanted to say that in results they write that plasma LPS level was significantly increased in depressed subjects at visit 1, but in visit 1, not all depressed subjects that would be depressed subjects were depressed subjects.
Yeah.
And it is strange because samples were post factum combined, but LPS levels were significantly different on the first visit.
Yeah, yeah.
But on the first visit, these samples, they there was another sample.
Mm-hmm.
So, and this is the first point that I wanted to say, and the second point is about the aim of the study. It was also being said, and I wanted to know what is the aim of authors. They would like to know how to prevent postnatal depression, but not all depressed subjects were depressed postpartum.
Mm-hmm.
Or they wanted to know mechanisms of depression, why they didn't measure sex hormones. Because in discussion they write about that sex hormones increases this microbial translocation, and this microbial translocation directs to depressive symptoms. Why didn't they measure sex hormones then? It's strange also. So these 3 points I wanted to say.
Yeah, thank you. I just also noticed that how they talk about this like screening for depression, and they don't actually in the paper they don't talk about like collecting data or about depression 3 times and how they actually define this factor, depression or non-depression. And about hormone sex, I don't know. I think that sex hormones. I think this is like okay that you like if you have like small study and like usually research is restricted by different factors, also like finance, and you should choose something. And so here they focus on immune system, not on hormone system. So that's why they probably they put it in discussion just for like probably it's their like future direction for future research. So I think it's okay that it's not here because you couldn't see everything, everything what you think important. It's like you couldn't control for any confounder. You need like a big sample size for this. So it's like limitations, but it's good point. Okay, and we have Pavel who have information about what is good about this paper. Maybe we don't notice something good.
Actually, it is hard work to notice good points after this discussion. I don't know, especially when I noticed the manipulation. So the main points, good advantages of this study is that it was approved by IRB, and it is a clinical trial that was conducted with high standards. It's good that they used very clear methods of detecting LPS and TNF and other cytokine levels because the study is reproducible. And in my opinion, the aim, the hypothesis of study methods and results, they are consistent throughout the paper, and conclusion is balanced because they don't say that microbial translocation leads to the increase of inflammatory cytokines and that leads to depression. They just say that these two findings are associated. And this study is I think is new because as they said in the discussion part. There was a study with immunoglobulins, but this only represents the human organism response and doesn't directly show the level of microbial translocation. So maybe the method of usage of lipopolysaccharide is good here. Good point here. And it's a little work, but it's honest. I wanted to say this at the end, but after the my findings about how they define the depressed subjects, I doubt in this point. So I think that's all I wanted to say about the advantages.
Thank you. And I totally agree with you. I think this paper, like, it's 2 pages, is first advantage. It was not really like a lot of work, but I think this is like a great paper, like, and I think I will use it for to see how to write like short paper, like short communication paper, and how to present data, like when you have a small sample size. And I think I actually really appreciate how they presented, and I think it's like clear and yeah, and totally agree with you, Pavel. Anastasia, maybe some like resume.
Okay. I think that the biggest advantage of this article is that it is great for such kind of journal club because we found a lot of some things that need to be discussed in this research. And that's why I like this paper when we found it.
Yeah, it was great.
And it doesn't mean that we like the kind of study, and I really don't think that it is useful to be true, but it's useful to discuss.
Yeah. Okay. Lilia, maybe like you have any other, I don't know, points to say?
No, I think that is all, and I'm glad. I hope that it was useful for every one of us, and it's good that everyone found something to say about this article, and it's wonderful.
Very good. I'm really enjoyed our journal club. So this was like last journal club in May. Just very short notice. After this journal club, you receive kind of very strange questionnaire. Like usually we send you a survey about like how you like this class, journal club, and what do you do differently. And after this journal club, you will receive the questionnaire. And I ask you about like all journal club which you was involved, probably as presenter or as a listener, it doesn't matter. And I would like everyone just probably take just like 5 minutes and complete the survey. It's super important because it gives me information about how the journal club work and what we can do differently. And about June, we probably would have 2 journal clubs, and I will, of course, email you as we usually do. Thank you, Marina, for helping me with organization all of the journal clubs, and everyone who participate in organization and in discussion in like during any other journal clubs as well. It's for me was a very dramatic experience of doing this, and I hope that everyone enjoyed it, and more importantly, it was useful and it's give you some new knowledge or new skills. At least you probably stop being shy to speak in English, which is also kind of advantage to participate in Journal Club. Hope to see you on next Journal Clubs. Hope we will do this. Anastasia, thank you a lot for choosing these great articles for our Journal Club today. And if you have any other questions, concerns, and ideas, please write me. I think that's it. I record this Journal Club, and as always, so I stop